I was so surprised to realize that I wasn't broken. It was huge. I cried when I got a diagnosis to realize that there was something identifiably different that was a legitimate challenge and that it wasn't me. It wasn't a personal failing. That was huge. And it changed how I thought about myself. It changed my confidence. It was a big realization.
Welcome to ADHD and with Jorie Houlihan. I am your host, Jorie Houlihan. I am an ADHD life coach, speaker, and your guide for the dopamine deprived. I myself was diagnosed with ADHD at the age of 49, 30 years after the first time I tried to talk to a doctor about it. Good times. All right. I think you guys are all going to find today's guest a true inspiration. I've been so excited about this interview. And I think you're going to find this, especially if you've really struggled with your ADHD. Carolyn Mallon is a doctoral prepared psychiatric nurse practitioner, practice owner, and someone who brings both clinical expertise and lived experience to the topic of ADHD in women. Carolyn is the founder of Balanced Mental Health in Concord, New Hampshire, a neurodivergent affirming practice specializing in trauma informed psychiatric care. She takes a deeply personal approach to this work, one shaped by her own journey of resilience and self discovery. Welcome to the show.
Thank you. Thank you for that lovely introduction.
You're very welcome. I am very excited about this. When you and I spoke, I went, oh, one of the things I really want to do is show women who have ADHD, especially the ones that are really struggling right now. It's not always going to feel like this. There is hope, and I think your story is so inspirational. So let's just dive into the question. So you've shared openly about dropping out of high school due to undiagnosed ADHD. How old were you when you weren't diagnosed?
I was diagnosed at 28.
Okay, and
So luckily earlier than some, but
yeah.
far too late to have saved me from a high school experience that was the pits.
Yeah. So can you walk us through what changed for you in those years between and what finally gave you that push to go back?
Yeah, I mean, leaving school when I did, which was just when I was about to turn 17, it was the only thing that made sense at the time. And I mean that because everything was a struggle and it was just too much. And I know a lot of people with undiagnosed ADHD can remember having periods like that, and particularly around school times. But the constant feeling of failure and picking up on or even being told that I was lazy and that I wasn't giving it enough focus, that I wasn't trying, and it
Mm.
really, really makes you feel pretty terrible about yourself. And I got very depressed. I didn't want to get out of bed in the mornings. The last thing I wanted to do was show up on campus. And so I just stopped. I stopped going. I said, I'm not going to do this anymore. But that feeling, that internalized shame really stuck with me for several years. It didn't even occur to me to go back to school. I was done with it. But what happens in life is that you sometimes encounter an obstacle. And my obstacle was divorce and having to support myself because I got married relatively young. I had 2 kids. And when my kids were 3 and 6 months, I went through a horrific divorce.
Mm.
It's tough for anybody, but having 2 kids at that age and no way to support myself, that was terrifying. And that was what had me thinking, okay, I need to rethink the school option. And I think a lot of people can probably understand why that was necessary because I went and got a job, the only kind of job I could probably get with no high school education, which was working a retail job. And it can be hard work and pays less than I paid my babysitter.
Oh my gosh.
So
Oh
here I
my
was
gosh.
working my butt off so that on the days that my kids were with their father, I could make a little money. But the days the kids were with me, I was losing money. But they insisted on full-time hours. That's what they needed. So that's what I had to do. And so it didn't take long to realize that I needed a different game plan that wasn't going to be sustainable. But they had a great community college in town. And I started one step at a time. I did not think I was going to go to nursing school, let alone become a nurse practitioner, but I figured maybe I could do something. I got started. And I mean, long story short, though we will go into it, I got diagnosed with ADHD finally, and it made all the difference. It made all the difference. I think, if I hadn't gone back to school, I don't know if I would have just carried that weight around with me the rest of my life.
What were your first signs looking back that your struggles in school weren't about intelligence or motivation, but were actually something different?
I think there were signs early on. One of the most obvious ones was that they had me in this program for kids who had a lot of potential. It was called the GATE program, the Gifted and Talented Education Program. I was in that because I did well on standardized tests, which I think is kind of funny because you kind of have to focus for those. But I think the thing is that performing for an entire semester of school year was really difficult for me, but having the short term pressure of a test and being able to just answer the questions and move on was easier for me to do than a whole semester. So I would not turn in very much work, not be focused in class, but then I could kind of get the information out on a test. And so they had me in this program, despite the fact that I wasn't doing well otherwise in school. And then as I got older, that was even more noteworthy when I was in some honors classes. I mean, the year I dropped out of high school, I was in honors English, but then I was in Algebra 1 for the third time.
Okay.
So
Yeah.
if something got me, I was in. I was all in if something interested me.
Yeah. Yeah. I have a kid who is very much like that right now. And it's just like the stuff he's not interested in, it's like,
Yeah.
whatever. But the things he loves, he's doing really well. As you know, many women are diagnosed with ADHD later in life
Mhm.
versus at a reasonable time frame, like as far as I'm concerned anyway. So what was it like to receive your diagnosis as an adult? And how did it reshape your self-understanding? How did it change how you saw yourself?
Completely changed it. I mean, I was more motivated than ever to be successful at school because I needed it. Like there were kids, people in their late teens, early 20s in these classes who were talking about like, well, if I don't pass this class, I'll try something different. And I thought that's not an option for me. I'm paying for this. And I have no backup plan. I didn't have any family anywhere in New England. I was on my own and I had to do this. And so it really didn't make sense to me why, with all of that motivation and the need to do this, I still couldn't. I would read the same passages over and over again, and I would lose track of time and mismanage what I had to do. I had hard time with prioritization with my studying. I was all over the place. And just like in high school, this was causing me to feel really anxious, really depressed, which is very common when you have untreated ADHD. So I went to the doctor to talk about how I was really depressed. Like I was feeling really
Ah.
in despair. And we talked about why. And I explained some of these frustrations. And this doctor agreed to a trial of an ADHD med. And I thought, that's a good idea. I have a brother and a sister with ADHD.
The
They
signs
should have
are all
caught this,
there.
right? Yeah, the signs
Yeah.
were there, but I had always, I had been better behaved than either of
Oh,
them,
yeah, that makes a difference when
Right.
you're the good kid,
Yeah,
right? And
yeah,
you're the rule follower. Yeah, we get
yeah,
missed a lot.
anybody socialized as a girl growing up learns early on that you have to behave yourself and you have to know when to be quiet and you have to try very hard not to move too much and stay in your seat. And even if you're totally zoned out and you don't know what's happening, you learn to just pretend, that you're listening. And so people don't
Yeah,
notice when you're not.
yeah.
Um, when that doctor gave me that trial of the stimulant, I went to school and I was able to power through this work, a huge amount of work for pre-nursing courses. And it was completely different. The thing is that what should have probably been really exciting for me was also super sad because I thought this was it. Like a pill could have made all of this so much easier, so much earlier on. Like all my teachers had always said, "Oh, you have so much potential." And now I started thinking maybe they were right. And I was like, you know, I'm going to just tell you one of the things I hear people say in my office sometimes is like, well, medication, it's like a crutch. And I'm like, but it is, right? To an extent, because if you have something going on that impairs your ability to perform and you need the medication and it makes a huge difference, how is that altogether different than somebody who might have a physical disability and needs something to help them? If you have something that's making it difficult for you to adapt successfully to the neurotypical world and there is a solution, there is no shame in that.
I totally agree. I get really frustrated with people who look at it like we're either cheating or failing because we're using medication. And I'm like, no, I'm succeeding now because I'm taking medication. Yeah, medication changed everything for me. And I understand there are some people who can't take stimulant medication, and people do have the reasons for not wanting to, even if they can. And I don't want to shame anybody for that either. I just want to make it clear that for people who do use it, it literally could be the difference between life and death in some cases.
I
It
agree.
reduces impulsivity. My anxiety went down by half when I started taking it. I just thought it was a character flaw. I'm just an anxious person. And then I had always had this like low lying depression, nothing that made me want to go to the doctor. I just knew there was just something, right?
Yeah.
And that went away. And
Yeah.
I was like, "Oh my god, the whole time it was the ADHD, are you kidding me?"
Right.
So, yeah, I totally agree. That's a really great analogy. It's like, well, yeah, if somebody's got a broken leg, are you expecting them to just walk around on it? Like, you
And
know?
nobody says, "Oh, your glasses for your, nearsightedness, that's a crutch," or "You're
Yeah, you just
cheating."
need to eat more carrots.
Right. Yeah, exactly. And it is life-changing, and it can be the difference between life or death. And I remember the depths of my depression in high school and that shame I was carrying, and there were times that I was unwell. And getting treatment and being able to reframe some of those struggles to see it as like, wow, I'm overcoming some of those things. I'm doing well for myself now. It was both a sadness, a grief about how long it had taken to come to that realization, and also really exciting because I was able to apply myself and realize goals. I had never been able to reach a goal before.
Right? Oh, I made tons of goals and never
Right.
got there, and I stopped making goals because of that. And yeah, and the grief you talk about is very real. My first real bout with the grief after my diagnosis was when I started the medication, which I
Hmm.
didn't do right away because I thought that somehow magically in my head, now that I know what it is, it'll all just somehow get easier, which of
Hmm.
course is not how that works. And when I finally did start it, I was like, "Oh my gosh, this is what everyone else has been working with naturally."
Yeah.
Like, no wonder I'm so tired. I was living my life with my hands tied behind my back and didn't realize it. And that's when my grief took the form of anger. For a while, I was pretty pissed off. And for anybody listening who you're going through this right now, I just want you to know that's normal. This grief you're feeling is completely normal. You just don't want to get stuck there. So, and you have also mentioned too that you had grief over the missed academic opportunities. What did that process look like for you specifically, and how has it shaped your work that you do now?
Well, I went from dropping out of high school to going back very nervously to community college. Once I got treatment, things turned around so completely. I mean, even now it's hard to believe I ended up graduating at the top of my class. I was our commencement speaker, president of the Student Nurse
Oh
Association.
my gosh,
I was
I love this.
I was playing the game. I was loving it because for the first time in my life, I could do these things. It was so exciting. It was like a whole different world had opened up. And what had started as this huge reach, like maybe I can get my nursing license, then I thought, well, maybe I can get a bachelor's degree too. And then maybe I can go to grad school. And I got my doctorate. And I mean, gosh, I wish I could go back to those high school teachers and,
I
and
know,
say,
right?
look, I'm not a failure.
Oh
It was
my
so
gosh.
hard, but it was so exciting once it was possible. I just couldn't get over it. Sometimes I think about getting a PhD just because I can. It's such a different world when you realize that you can set goals and you can achieve them, that if you want to do something, there's nothing that can really get in your way. And what a difference from when I was younger, and no wonder when people get treated for their ADHD, often the depression and anxiety are so relieved because it's a different world. You can get things done, you can set goals, you can reach them, you can learn strategies to work with the way that your brain works.
It never ceases to amaze me, sadly, how often I have women I know who are like, "I'm finally going in. I'm gonna talk to my doctor about this," and they leave completely just deflated because they're like, "Oh, it's just anxiety," as if that's not its own problem, saying it's just anxiety. So often, the anxiety and the depression are sort of side effects of the
Hmm.
untreated ADHD. They can also be their own beast too. That's why, like, a full assessment's a good idea, so that you can parse out what that is. But when they're just dismissed like that, it just breaks my heart because when I think of how much potential has been left on the table because
Hmm.
girls and women are diagnosed so much later, and what that does to our confidence, what it does to our self-esteem, I mean, you were saying about how low you felt.
Yeah.
It just makes me nuts.
No, and I hear a lot of professionals who have that type of approach. Somebody comes to their office and says, here's all of these things that I'm experiencing, these difficulties that I'm coming up against. And I've got lots of professional colleagues out there who will say, oh, well, you've got to really make sure that they're not drug seeking, or, you've got to make sure you treat their anxiety or the depression first. And I understand there are times that that's appropriate. But the last thing I want to do, and this is my psychiatric hot take, is
Yes.
to give somebody antidepressants that they don't need when maybe what they need is an ADHD medication, because the anxiety and the depression often follow that. And if you improve these executive functioning challenges, maybe they don't need those other meds.
All right. So, having gone through all of this stuff, right? And then you went back to school and you got support, right? That
Yeah,
obviously changed the trajectory for you. What about for your children? How has that changed things for them too? Because
well,
can I assume that at least one probably has ADHD?
both of them have ADHD, absolutely. And, with my son, it was very obvious because, like a lot of little boys, he was hyperactive, impulsive, breaking things. Literally, he fell once because he stacked chairs on top of a table and was trying to climb them. I mean, and in class, he was very disruptive, had a really hard time with transitions. So in kindergarten, he had a full neuropsych assessment, and he was diagnosed with ADHD. With my daughter, it came later because she had a locker like a little rat's nest and was disorganized and didn't know where any of her papers were. I had to have some back and forth with their dad, who's a little less on board with ADHD treatment and understanding this because he doesn't go through it himself the way that I do. But I was very clear when my daughter was diagnosed that I was not going to let what happened to me happen to her, this internalization of shame and feeling like a failure when there was treatment, right? And I think also the fact that I got treated led to me being able to achieve academically. That led to me being able to achieve professionally. That led to me having an income that is such that I can support my kids getting an education. So this doctor who prescribed me Ritalin, like, didn't just change my life, it changed my kids' lives. It might change my future grandchildren's lives because
Hmm.
there's not this like intergenerational story of failure. I mean,
Yeah.
how amazing is that, that you can just treat this condition and affect a whole family?
Yes. It reverberates
Yeah,
everywhere. To see the difference in them when they have the tools that they need. Medication is a tool. And for some people, like myself, I needed the medication to learn the tools because I couldn't
right.
focus long enough to retain anything. When your kids start to feel like I can actually set these goals and do them, like to your point, right? Whereas before it was like always starting over and starting over and
Yeah.
I'm starting on Monday. Oh, I need a new planner. Oh, I got a perfect pen to go with the planner. I'll start Monday. And it's exhausting living like that. And so to see them not doing that as much as I did at their age that gives me hope. It absolutely
And it's
does
not
make a
just,
difference.
like I mentioned feeling like I'm in a position to get my kids ahead in life, but I also, the things that I had to teach myself, catching up on executive functioning strategies and study strategies, I've been able to help my kids and give them support that, gosh, would have benefited me when I was their age. I mean, my daughter is a sophomore in college, and when she has big problems with motivation, I can say, hey, do you want me to body double you? Like we can hop on a call and you can work on your homework and I'll work on something that I've got to get done, maybe a blog post,
Yeah.
those are things that I didn't learn about until I found strategies. For me, it was mostly in books and online communities that I learned some of these, like, brain hacks for ADHD. But then, I could help my kids learn these things early on. And that, combined with medication is making their lives, knock on wood, easier than mine was when I was their age.
How would you say your personal journey with ADHD has shaped the way that you support or relate to your clients?
I mean, I think the biggest thing is having a neurodivergent affirming lens to my evaluations and to treatment. I try really hard to impress upon the clients that I'm working with, like, you're not broken. We can give you some tools that are going to be helpful, but it's just our brains work differently. We have different skills and different areas that, I mean, who have I'm sure you've heard this before. Like, we didn't evolve to sit at a desk for 8 hours a day doing emails and Zoom
Yeah.
calls. And some people find it easier to adapt to that. Some people find that really, really difficult. And some people are chronically late and have time blindness, and some people don't seem to. Often I find that when I'm asking ADHD assessment questions, people will say, oh, no, I don't have any problem like forgetting things. And I'm like, but what are the ways that you're already probably accommodating yourself? For me, I'm not late for anything. I don't forget anything, but that's because I have a calendar, two calendars, and each one is set up so that it automatically emails me my agenda at the beginning of the day. I have pop up notifications an hour before every event and then 5 minutes before every event.
Yes.
And I have so much anxiety and hypervigilance about letting people down that it
Yes.
looks like that's not a difficulty for me, but it clearly is, right?
Yes.
It
Yes,
can hide.
exactly.
Yeah.
Yeah. It is the not understanding that how we do things, how we process information is different. And you said before too, like you tell clients, like, you're not broken. You just process information differently. And I am doing the same thing. I'm like, literally, you're not broken.
Yeah. And what you mentioned about how, you don't notice these things if it's normal for you. ADHD is highly heritable. So if you have ADHD, whether it's diagnosed or not, chances are one or both of your parents have ADHD and you've been growing up in a neurodivergent household the whole time. So what looks normal to you can be totally neurodivergent and obvious to somebody different. But to you, that's just like how families are. That's how households look, you
That's
know?
Tuesday. Yep. That's
Right.
like, yeah, exactly. I have accidentally helped a lot of women discover they have ADHD because when I talk about it and they kind of go, well, I do that. I'm like, uh huh. And I don't say anything because I'm like, I don't know, and one characteristic doesn't necessarily mean ADHD, obviously. But then as I continue talking, I see looks on these faces where they're just sort of like, ooh, I think this is me. And I always say, if you aren't sure, it's good to get an assessment.
Yeah.
I wish they were a little bit less cost prohibitive, but I
Mhm.
also understand there's a whole lot that goes into these because they're not just assessing for ADHD, they're assessing for autism and bipolar and schizophrenia and depression and anxiety and all that stuff. But then you'll know. And if it isn't that, then you'll know. All right. What are some of the most common misconceptions that you hear about regarding ADHD in women? And how do you address them with your clients or with the public? Because there's a lot out there.
There are. I think one of a common misconception that I see in my practice are people who think that the fact that they're having these issues now, but they can't identify or describe how it affected them when they were younger means that this isn't ADHD. And I see professionals also make this mistake where they ask some questions from a little worksheet about, did you have difficulties academically in school? Were you unable to sit still? Did you get out of your seat often or talk out of turn? And just like I said, some people are socialized in such a way that they're able to mask and behave themselves in most circumstances, or they're not having all of those struggles, or they have a family that provides a lot of external structure and support. And they may be very intelligent, so they can get away with passing grades because they can perform well on a test, even if they can't hand in work. And so they might think, well, I got good grades and I wasn't hyperactive. And even a professional might be like, well, then you don't have ADHD. But you have to
I've
think.
seen that happen. I have a Facebook group that has like 30,000 women in it. And I can't tell you how many times that's exactly what they come back and they say. They said, well, because I have a master's degree, I couldn't possibly have it. I'm like, then you need to find a new doctor. Like, just go find a new doctor. This person doesn't know what they're talking about. They probably still think it only happens to boys. It's so frustrating to me that I wish more doctors would just be more open to saying, I don't know.
Mhm.
I think there's this fear that doctors have of saying, I don't know, as if somehow that will make them seem less capable in their patient's eyes. I would have so much more respect for you if you said, you know what, this isn't where I specialize. Let me find somebody who might be a better person for you to talk to. You know what I mean? Like, don't just dismiss people out of hand, especially if you have no idea what you're talking about with this one, because it's so deflating. And for people who are listening who are neurotypical and you're going, what's the problem? This is part of executive dysfunction.
Yeah.
Okay, so, any other misconceptions that you would like to.
Well, something I see often, and it's sort of a related thing about feeling like you don't have the early signs and maybe you don't have ADHD then, is that in perimenopause, women's symptoms of ADHD are exacerbated with these hormonal fluctuations. It becomes even harder. And so I also have people who come to me and say, well, you know, I didn't have those difficulties before, but I'm having them now. Or I had them before and it was like I didn't need medication, but now everything feels like it's spiraling out of control. And so it takes some education for not just the client, but for a lot of providers to realize that it's not in their heads. Their executive functioning is worsening. Their symptoms are more acute. It's a difficult time. And just like there's now more education in general and conversation about perimenopause, there needs to be more conversation for ADHD women who are hitting perimenopause and need that extra support. They're not imagining it.
No, no. Well, because dopamine is connected to estrogen,
Hmm.
and so when estrogen plummets, our the dopamine we do have, like, it, because there's also, like, firing mechanisms that don't go off at the right time. Like, everything just gets so much worse, and for my friends who don't have ADHD that are suddenly complaining about, like, all this stuff, I'm like, "Yeah, I've lived there my entire life." Like,
Right,
you
right.
just hit the tip of the iceberg, and now imagine this, like, 1,000 times worse, because that's where I am now, and they're like, "Oh my god." I'm like, "Yes,
Hmm.
now you get it."
Yeah, absolutely.
Yeah, perimenopause and menopause, man, it is brutal. Even if you don't have ADHD, it is a lot. And our bodies change so much in such a quick period of time. It's brutal. Okay, so let's change things up a little bit here. So you spoke about developing your own study and coping skills, and you recommended the book Learning Outside of the Lines.
Yeah.
And I got that book and I started reading it, but I also my mind wanders a lot when I'm reading and the letters are really small and I'm just like, can I get the audiobook version of this? I probably should have both. Because I listen to audiobooks while I'm reading, and that helps
Yeah.
me to stay focused. But anyway, and which is a really great book, though, for neurodivergent learners. So, can you share what some of your favorite practical strategies for working with and not against your neurodivergent brain would be?
Yeah. Well, like you said, it really is specific to the individual and how their brain works. And one of the things that was so great about that book when I found it was that they spent some time talking about all these different ways that people learn. People have heard this, like some people are auditory learners or visual learners, or they need to be hands-on. What I learned was that mixing those all in as much as possible was really helpful for reinforcing learning. And so I would, you know, draw out the different structures, anatomical structures when I took anatomy and physiology. I literally draw on my flashcards and label them with colored pencils. But then I would go to the lab and they had models of different body parts with ligaments and blood vessels and things. And I would trace my finger along them and say them out loud. And I would record myself reading over my notes and then listen to those recordings when I was taking walks or going to the gym or standing in line at the grocery store. And I found that just reinforcing the information through as many senses as possible made stuff stick so much better. I even got a gig teaching part time in the lab, the anatomy and physiology lab, because you don't have to be an expert in there for anybody listening who's in college. Like, these are great gigs because you get a chance to study. And by teaching other people, you're reinforcing that information. So I wasn't the expert, but people would come in and say, I'm having a hard time learning about the different types of cells. And I could take out the slides and we would go over them and review them. And it was reinforcing the information again for me, helping other people out. Plus, I made a little bit of money. It was great.
I love all of that. I think that integrating as much as possible, like I just mentioned, actually, like reading the book while listening
Yep.
to the audiobook, that's what helps to keep me focused. Okay, so how do you approach setting realistic expectations? Whether it's for yourself or your clients or your kids, especially on days when motivation or your executive functioning is just not cooperating.
Well, I think it's reasonable to set expectations that reflect reality. I'm not going to be able to force myself to make 10 phone calls in a day, even if I have 10 phone calls that need to be made. You have to just come up with some little hacks and be reasonable with your expectations because for some people, making a phone call is a total win. I'm sure there are neurotypical people out there who can just take care of business and make all the phone calls they need in a day and schedule their doctor's appointments and call in their refills or whatever it is that they're doing so well. But it's not that way for everybody. And overcoming procrastination and difficulties getting started on tasks, those things are like legitimately challenges for a lot of us. There's
Mhm.
this TikToker that you may be familiar with. She does this series called How Much Time Will It Take?
Mm,
Each little video is her saying, here's a task that I've been procrastinating because I think that it's going to take forever. And I'm just like, I've been avoiding it for like 2 months. Maybe it's cleaning out a closet or under her sink, or maybe it's making a doctor's appointment. She had one where she was going to the dentist and she times the things and then says, like, this is how long it actually took. And what's the stunning takeaway is that we dread some of these things because the ADHD mind has to not, we don't do things automatically. Our brain is attacking it step by step by step. There's all these
yes.
pieces that have to go together. You have to do them in the right order. You have to plan ahead a little bit. And it can seem so overwhelming that you just avoid doing the thing altogether. But she'll show that she cleaned out under her sink and gosh, it only took 13 minutes. She avoided it for 2 months. Turns out it took 13 minutes.
And then they usually say, "And I will learn nothing from this." 'Cause we continue to do it.
Yeah.
That's one of the first things I have clients do is I have them track where they know they lose time.
Yeah.
The things that they dread, they think will take 3 to 4 times how long it will actually take.
Right.
But things that they are neutral to or look forward to, they think will take half the amount of time that it will take. So they think, "Oh, that'll just take 10 minutes," and it'll take 20.
Hmm.
And I like what you pointed out too, which is some people will look at laundry as it's laundry, it's a task. But
Right.
we look at it as several steps, right? Gathering the laundry, sorting the laundry, putting it into the wash, like they're all a task. And like you said, and they have to go in a certain order. And sometimes it's just overwhelming. And yet sometimes things that are super complex in the right
Right.
circumstances, we're like on top of it. And everyone's like, laundry brings you to your knees, but
Yep.
you can do this. And then,
Right.
yep.
I'm into film photography and darkroom printing. And I had somebody asked me like, "Oh, well, how did you learn to do that?" I learned to do that with a book, and I was so excited that within literally like 3 weeks, I had a dark room in my basement. I had amassed all of the things, and I had like learned how to develop film, and I had learned how to use the enlarger, and I had all this stuff.
And you still
And
do it?
I do, but not at home anymore. We moved, and I don't have a dark room in my basement now
Okay.
because we have laundry there.
I'm just impressed that you continued because I go on these hyper focuses and it's like the new hobby and I get all the things and then it's like fizzled out after like a week. I know when I am in that dopamine infused hyper focus, especially if it's something new, I stun myself sometimes. I ask myself that same question. Wait, I can't do laundry, but I just knocked out this whole giant project in a
Right,
day. And it's because, yeah, I was super interested in it. The dopamine kicked in. It was novel. It was challenging. It was exciting. It had all the elements, right?
right.
Okay, so you mentioned being curious, which is one of my favorite words when it
Mhm.
comes to ADHD. You mentioned being curious about what works for you at a given time and giving yourself permission to start small.
Yeah.
Love it. Love it. Can you talk about how you practice that and teach it? How do you teach that kind of flexibility? Because some
Mm,
people with ADHD are afraid of the flexibility because if I say you don't have to do this every day, they panic because they're like, but
yeah,
if I skip a day, I won't go back, right?
right.
And also that the self-compassion that we need to have for when we do, like, miss a day kind of thing, like, it's not we don't throw the whole system out
Yeah,
like I used to do, right?
right. That's exactly right. Yeah, some of us do throw that all out.
It's that all or nothing thing. It's like, "See, it
Yeah,
doesn't work. Throw the whole
yeah.
thing out." So many times, so many times. So how do you practice it yourself, and then how do you teach it to people?
Well, one of the things that I do, I will tell myself if I can just do this thing for 5 minutes, and it's a trick. I know it's a trick, and even though I know that it still works, I'll tell myself, "Okay, I don't wanna do the laundry, but I'm just gonna time myself 5 minutes, and if in 5 minutes I don't wanna be doing it anymore, fine, I'll do something different." And most of the time, not all the time, but most of the time, once you get into the like pattern a little bit, like, the timer goes off and you're thinking, well, I've almost got this wrapped up. I'll just finish it up. And especially if it's like a task that requires some creativity and focus, but you've been putting it off, it's like once you get in there, it goes okay. You just have
Mhm.
to trick yourself 5 minutes and, the thing is it can't be a total trick. You have to allow yourself, if after 5 minutes you don't want to be doing it, just give yourself a break. Find something else. You can come back to it. If you end up doing that task broken up over a series of days in 5-minute increments, that's okay. It doesn't have to be all done at once. But that inertia when you're starting a task is hard to overcome. So if you can find a little trick, make a little game, a challenge out of it, that's often the best way to get started. And in school, I use the Pomodoro method. I'm sure you're familiar with, the timing and like giving yourself the focus time and then the break time. And you have to give yourself those breaks when they come up because there's only so long that a brain can focus on anything and actually be like, especially with studying, actually be absorbing the information. That's why they make lectures not 3 hours generally, but like 1 hour, because after an hour, you need a break.
Yeah, and I used to do theater, and there was a thing, at least back when I did it, that was called the 50-minute rule, which is
Mhm,
if you go longer than 50 minutes, 50, people stop paying attention. And so you wanna have one of the intermissions after every 50-minute,
mhm,
at the longest.
yeah,
And I've heard people say, "Oh, Pomodoro doesn't work for me," but it's because they're afraid of the breaks.
mhm,
And I teach people how to take breaks because I'm
yeah,
like, there's certain steps that, like, I get it because there's that fear of if I stop, I won't go back. But I'm like, the big rule is no sitting. Like, don't sit, start doom scrolling. That'll be the end of
right,
it, right? Like, if you have to sit, like, make it a fairly uncomfortable chair where you're like nourishing yourself, getting some water, but also know exactly what you're doing when you come back. Not generally like, oh, I'll just keep working. No, no, no. You got to be specific because you're going to come back and your brain's going to go vagueness, vagueness, and then that's it. You're done. I do understand the fear of the break. And when I tell people they have to learn how to take breaks, they
yeah,
look at me like, "Wait, I thought you knew how this worked. We don't do that." And I'm like,
right,
"You don't yet. You will."
right. Because that method doesn't work if you don't take the break. Well, then it's just a punishment. You're going to sit down and just keep working and working and working, and you're not going to want to do it.
Well,
You
yeah.
have to know that you can look forward to the break.
Yeah, and if you continue to work without breaks, your work gets worse, doesn't improve. But I like how you talk about you have to give them the self compassion of if you stop after whatever that short step is, and I tell my clients the same thing. I'm like, then you did what you committed to. You
Right.
can say, I can check that off the box. And then if you don't want to continue, it's okay. You just do the same thing tomorrow or
Hmm.
whatever day works or whatever. But allowing that, I think, does take a lot of that pressure off because that all or nothing thinking can be brutal.
Hmm.
So it's like, well, I have to do all the things. I'm like, you don't. I know this. Trust me, I have lived this and it is so much easier to do hang 3 items. Do I still feel like doing 3 more? All right, I can do 3 more, right?
Hmm.
And you're right. Every once in a while, I don't finish it, but I do give myself that, like, if I don't, then I did what I said. So
That's
I
right.
love that you do the same thing because not
Yeah.
just me telling them this.
Yeah. Yeah. The other thing I do to kind of trick myself into doing something is to combine like something that I'm enjoying doing with something I don't enjoy doing. And, that could look like when I was in graduate school, we had to do this big training on medication assisted treatment for people with substance use disorders. It's hours long to get this credit for having completed the course. So I set it up so that I could share it to the TV screen. And I set up a sewing table and I would sew while I sat through the lectures. And
Yes.
it was great because the sewing to me is like automatic. I'm not like really thinking hard about what I'm doing, but it keeps my hands busy. It's something that I enjoy doing. And
Well, I mean, and that actually makes a lot of sense because they also say that like handwriting out notes
Mhm.
versus typing is
Yeah.
more effective. And I think it's because I can remember like when I would take tests, I'm like, I can see it on the page where I
Yeah.
wrote it, what it looked like, right? And I don't have a photographic memory, but that kind of thing, that's what works for me. So yeah, I think that's and I love that I think it's very effective too, like combining something you don't like with something you do. I think that's a very effective tip. I love just listening to music while I'm doing something
Mhm.
like laundry or something, and that's also really helpful.
Yeah.
Okay, so you also highlight the role of environment and community. We control our environment.
Mhm.
I think it's funny because we do sort of accidentally find our people, right? Like there's so many people in my life from my past that I've gotten reconnected with, and we all have ADHD. I'm like, okay, yeah, this tracks. How do you help your clients choose who and what to surround themselves with for better mental health?
Well, I think online communities are a huge blessing. I mean, I always think about how different my experience would have been in high school if we'd had more than just email. But like you mentioned, I do think it's interesting how many friends you've like over the years just sort of attracted because your brains work in similar ways. And so it is not your imagination when you realize that 75% of your friends have ADHD and
Although
like mine.
back then I would be when I would be questioning it, I'm like, well, so and so does it and they don't have ADHD. I guess I'm fine. And and then I find out later, oh no, they had it.
Yeah,
And they were doing the same thing with me. They're like, yeah, I'd be like, well, Jorie does that and she's fine.
right.
Okay, so what advice would you give a woman who is newly diagnosed and feeling hopeless or overwhelmed right now?
I think my biggest advice as a mental health provider would be to get a good neurodivergent affirming therapist and probably somebody to prescribe if they're interested in medication options. And there is a difference between people who say, yeah, I know what ADHD is, and people who have a neurodivergent affirming lens who don't view ADHD as a problem to be solved. I think that sometimes people ignore that some of the habits and pitfalls people fall into at one point were adaptive. It made sense given what they were dealing with. And you can't just pathologize and say, oh, well, you have this disorder and we're going to try to fix things. It's great to be able to like find little hacks that work for you, identify your strengths, that kind of thing. But I think it's really important to find somebody who really gets it. And I think the best neurodivergent affirming providers are people who are neurodivergent. There's plenty of us out there.
Oh my gosh, yes. When I people hear people call it a disability and I'm like, it's a difference. Our
Mm.
brains just process. I My new favorite way of explaining it is while the rest of the world has a PC brain, we have Macs. And the problem is not having a Mac brain, it's the fact that we were given the PC manual to work with. So you just have to figure out what your manual says, right? And people go, okay, I get that. I'm like, yes, see, it's just we've just processed the information differently. It does not mean it is wrong. So, what impact or legacy do you hope your story and work will have in the next few years? Because it's a great story.
Thank you. I mean, I guess it's just, I hope that to the extent that my story is out there, that the people who listen to it, who see themselves having had that struggle, can also see somebody who is able to reach their goals and turn things around. And the goals that each person has for themselves are very different. For me, it was really important to have some academic success. I had this chip on my shoulder about it. And for me, as a single parent, I really, really needed to get ahead in that way. But for other people, their goals may look totally different. The point is that once you have the glasses that are addressing your nearsightedness,
Hmm.
everything gets so much easier. It really does. I mean, there's every reason to expect that things will get better when you get treated. It's not just this, this label that now you have to carry. You create your own labels, right? We decide who we are, we decide what we want to be, and once you get treatment, like, you can go be that thing.
Yes, you can go be that person that you see. I would just see myself as like, I always thought I would be so much further along in my
Mm,
life. And I just was like, how come I can't be that person? And now that I have gotten treatment and whatever, now I'm not there yet, but I'm definitely further along than I would have been. The fact that I have had this podcast going since October and I only took 1 week off, I
wow.
think that
Yeah,
says a lot, right? Because there's a lot of
it
work that goes
does.
into this. Okay, yes, I agree, and I also want to just back up what she's saying. When you get the right tools, when you understand your brain, how it works for you, and looking at it through the lens of curiosity, that's so important, not the lens of judgment, because the judgment just brings more judgment, and you've been judging the shit out of yourself. You can stop that now. Look at it with curiosity. That too changes a lot. So, okay, it is now time for the rapid fire round. So I'm going to ask you a series of questions and just answer them top of head, whatever comes first.
Okay,
And are you ready?
I'm ready.
All right. What is one ADHD friendly habit you use every single day?
Hmm. I think this is counterintuitive for some people, but breaking down tasks into a million little parts, because I like the satisfaction of scratching off each line. So, like, even, doing the laundry, you can break that down in like 15 steps. And it makes me feel
Yes,
really good to see myself getting through it.
exactly. But yes, as you said, there are some people that they see that list that are like, oh, and it will overwhelm them. Break it down to the steps that you feel comfortable with. But yeah, I like that. Okay. Book, podcast, or resource you wish every woman with ADHD would check out.
There's a great one, The Radical Guide to Women with ADHD. It's a workbook, and
Yes.
it's written by some therapists and uses a type of therapeutic approach, but it's kind of like interactive. It's a classic. It's a really good book.
I agree. I really like that book a lot. One thing you love about your brain.
I love that if I get interested in something, I can learn all the things. It's like there's no limit to like the information that I can, put together and incorporate and like creating things. Like when I learned photography stuff, I mean, I just picked up a book on black and white film photography, and like 3 months later, I was a pro.
I love that, right? It's amazing. All right. Favorite way to recharge after a long day at the clinic.
Mm, bathtub.
Mm,
Yeah.
agreed.
Yeah. It's my favorite place.
Yeah. My husband's like, you're taking a bath again? Like, uh huh.
Yeah.
Yeah. There's just something about it. I agree. All right. Last question. What is the most surprising thing that you have learned about yourself on this journey?
The most surprising thing, I mean, at the risk of sounding, sentimental, it's just, I was so surprised to realize that I wasn't broken. It was huge. I cried when I got a diagnosis to realize that there was something identifiably different that was a legitimate challenge, and that it wasn't me. It wasn't a personal failing. That was huge, and it changed how I thought about myself. It changed my confidence. It was a big realization.
Yes, I'm very happy that you had that realization. And so I really want to thank you so much for being here today, sharing your story. And I know that you have inspired a lot of our listeners who are, especially ones who are in that place right now where they're just like, oh my gosh, is this ever going to get better? You are a clear example of somebody who took her knowledge and took a diagnosis and made it work. And you've just been doing amazing things. So, thank you so much for being
Yeah,
here.
thank you for having me.
How can people reach you if they wanna reach out to you?
Our website, balancementalhealth.com, and we are on Facebook and Instagram and even YouTube with some little bio videos about some of the providers here.
Awesome, okay. So I will be sure to have all of Carolyn's information in the description as well. Thank you all for joining us today, and let me know in the comments, what was your biggest takeaway from the conversation today? I've got a lot. So, let me know in the comments. I love to read what people are taking away from these things. And if the show resonated with you, please give us a follow, leave a review or a comment, and share this with a friend who could use it. I'm pretty sure you know at least one. And there is a link in the description that makes it really easy to leave a review. And the more people do this, the more ADHD women we can help. So thank you again for joining us. This is ADHD and with Jorie Houlihan. And until next time, stay curious.